We get the question all the time. Does this count as clinical
Oh,
experience?
the dreaded question. Yes.
We talk with employers all the time. We're talking with students all the time about this question. And I'd love to sort of get your perspective, like advice that you would give to students who are asking this question about how to think through it.
Yeah, and I think it's really important when students apply for these gap year positions in the healthcare setting, they do think strategically about what am I going to get out of this experience that's going to help me grow as a person, not just in terms of candidacy for med school, PA school. And the general rule of thumb is any position where you're either going to be interacting with patients or interacting with the person you want to become, so whether that be a physician or a PA, or the healthcare team as a whole, is going to help you learn something you didn't know before about who you want to be in your own career. So really the most important thing is there patient contact, or is there contact with whoever it is you kind of want to role model your career after?
Are there particular kinds of experience that are better or worse when you're thinking about it? Or if they ask the question, like, is this good clinical experience? How do you answer that question?
Yeah, so this constant does it count, I think is the wrong question, and I think that's part of the problem, right? The question is, am I going to learn something about patients again? And am I going to learn something about being a physician or a PA? And so that really can encompass a whole lot of jobs that really intuitively you might not think are correct, right? So, for example, a job being a medical assistant is kind of the ideal. That's the one we tend to highlight on our job board the most because you're both working alongside a physician or a PA and you're caring for patients,
Mm-hmm.
right? So you really get both sides. However, there are jobs like community health worker, which are a little less traditional, where you're actually just working with patients in the community, identify resources to help them meet their health needs. And although that isn't like patient care, like I'm taking vital signs or I'm, doing procedures, it is about learning about the social determinants of health, which are
Mm-hmm.
critical to like how you're going to deliver care in the future as a PA or a physician.
So, if you were to sum it up, this question of does it count, and is this clinical experience going to be good? How would you sum it up?
I would say at the end of any shift, if you're able to think of one or two things that made you think differently about how you're going to either approach your career, whether you still want to pursue your career, or what you're going to do better when you become a physician or a PA, then it is a clinical experience.